Welcome to Canterbury Life. Thank you for joining us today. Now we have such a full show that we don't even have a single second to tell you any of Joe Kane's fast facts. But I can tell you who is on the show. Paula from the National Beer and Doll Show is here. Gardening specialist Rachel Vaughan is here to give us some winter advice. And we head to the movies with John Hunter. But first up, Dr. Allan Simpson on the very important issue of glaucoma. Welcome to the show.
Thank you.
Now, it's Awareness Month for glaucoma. Tell me, what is glaucoma?
Glaucoma is a group of conditions that's characterised by pressure damage to the optic nerve at the back of the eye, which is where the nerve fibres from the retina collect up and go back to the brain.
So how serious is it a problem here in New Zealand?
It's serious enough. It's a significant cause of blindness if it's not picked up and treated and prevented. It's estimated that about 70,000 people in New Zealand have glaucoma over the age of 40. And I guess the problem is that half of those people don't know they have it.
So how can people tell that they do have glaucoma?
Well, the problem is it sneaks up on you like a thief. You lose peripheral side vision initially without realising it for quite a long time. And then eventually that becomes enough of a blind spot in your visual field that you'll know it, and it can go on progressing after that as well.
So is this people even that don't have vision problems, they don't wear glasses, they can see, they start losing their peripheral vision?
Could be. But it typically happens after the age of 45, 50, and the older you get, the more likely it is to happen. Yeah.
And what about families? Does glaucoma run in families?
It does run in families, not exclusively, but if you have a family member with glaucoma, you'll probably be 5 or 10 times more likely to have glaucoma yourself. So you should have a checkup in that case as well.
So is everyone at risk? I mean, you say that there is a possibility that people with glaucoma in, in their families. Is everyone at risk of getting glaucoma? Everyone
is at risk, and the best time to have that examined for is when you need your reading spectacles at the age of 45 or 50. It's all very well going and getting a cheap pair of reading spectacles, but you should not do that at the expense of having a proper eye examination by, say, an optometrist who will screen for glaucoma and look for glaucoma, because that's the perfect time to pick it up. And thereafter, every 5 years, you should have an examination, a proper eye examination after the age of 45, and after the age of 60, probably every 3 years.
Okay, so why is the 45+5 glaucoma eye examination so important?
Well, because that's the time it happens increasingly. It's rare to get glaucoma before that age, and also 45 is a great time in a lifespan, because that's when you start needing your reading glasses. It happens to all of us that we lose our capacity to focus up near and therefore need reading spectacles, so it's a perfect time to have a screening check for glaucoma.
Okay. Excuse me, I do have a bit of a frog in my throat today. Now, who does the eye examinations? Do you do them yourself? Do you have to go to a specialist eye clinic?
I'm an ophthalmologist and I certainly do them, but we would probably recommend that in that situation you should see an optometrist and have your spectacle exam and also the screening examination for glaucoma and other things as well.
So what sort of harm does high pressure cause to the eye?
Well, it typically damages the optic nerves from going from the retina to the optic nerve, to the brain, and at the optic nerve where they leave the eye, they're particularly vulnerable to pressure, and they just gradually drop out. And because there's about 1 million nerve fibres in that optic nerve, and if you lose too many of them, you start losing the peripheral vision that they subserve.
So I've got to ask, if glaucoma has no symptoms, I mean, you do say the peripheral vision, you do lose that. Why does it need to even be treated?
Because I see in too many people that come along with quite advanced glaucoma, and they've actually lost all their visual field in one eye, not to mention half of it in the other eye, and that starts to become a real issue for quality of life. They will notice it at that stage. They will possibly lose their fitness to drive, and very rarely, if it's not treated, not picked up, you will go blind, because you also lose your central vision ultimately as well. So that happens rarely, but it can happen if it's not treated.
All right, how can we treat it?
Well, we have lots of ways, but it's all about lowering pressure.
Right.
We can do it with eye drops, laser treatment, or surgery, basically. So it's medical or surgical, the treatments, but they're all aimed at lowering pressure to a sufficiently low level to stop that damage occurring on a progressive fashion.
Is it curable?
No, it's not curable, but it's controllable. So it does mean a lifetime of often eye drops and regular monitoring to make sure that that progression is not happening and that the pressure is low enough to stop that progression happening.
So are you part of Glaucoma New Zealand?
Yes.
So who are they?
It's a charitable organisation that was set up 2002, I think, basically to provide support to try and prevent glaucoma blindness occurring and to provide support for patients that have glaucoma. They send out information to glaucoma patients who register, and they also support research into glaucoma treatments.
Now, I'm just looking at our screen and I recognise that man there on the left, Sir Richard Hadley.
Yes, indeed.
So what's his involvement with Glaucoma New Zealand?
I think he's supporting Glaucoma New Zealand's Awareness Month in July this year and doing the right thing by going along and getting his eyes examined.
So how can people find out more about Glaucoma New Zealand and, of course, Awareness Month?
Good question. I guess they could log on to the website, glaucoma.org.nz.
Excellent. Dr. Allan Simpson, thank you so much for coming on the show today and sharing with us what glaucoma is, because I certainly didn't know what it was. So thank you so much for that. Stay with us straight after the break. We're talking gardening with gardening specialist Rachel Vogan.